The occupation of an emergency medical technician and paramedic are just two of the many options available to you in the career pathway of health-related occupations. A career pathway is a cluster of occupations or careers that are grouped together because many of the people working in those specific fields share similar strengths and interests. Selecting a career path provides you with an area of focus, along with flexibility and a variety of ideas and occupations to pursue. Deciding on a career path now can help you prepare for your future. During the next few minutes, you'll be given the latest information on the nature of work, working conditions, employment, training, job outlook, and earnings for the careers of an emergency medical technician and paramedic. All right, let's get started. Emergency medical technicians, also known as EMTs, give immediate care and then transport the sick or injured to medical facilities. They determine the nature and extent of the patient's injuries or illness, while also trying to determine whether the patient has other pre-existing medical conditions. Once they have all the information, they can give appropriate emergency care. There are three types of emergency medical technicians: EMT Basic, EMT Intermediate, and EMT Paramedic. EMT Basics may open airways, restore breathing, and use the automated external defibrillator. EMT Basics may also control bleeding, treat shock, administer oxygen, immobilize fractures, bandage wounds, assist in childbirth, manage emotionally disturbed patients, treat and assist heart attack victims, give initial care to poison and burn victims, and treat patients with anti-shock trousers. EMT Intermediates have more advanced training that allows them to administer intravenous fluids, use defibrillators to give life-saving shocks to a stopped heart, as well as other intensive care procedures. EMT paramedics provide the most extensive pre-hospital care, in addition to the procedures already described. Paramedics may administer drugs orally and intravenously, interpret electrocardiograms, perform endotracheal intubations, and use monitors and other complex equipment. When transporting patients to a medical facility, EMTs may use special equipment such as backboards to immobilize them before placing them on stretchers and securing them in the ambulance. While one EMT drives, the other monitors the patient's vital signs, gives additional care, and maintains contact with the hospital. At a medical facility, EMTs transfer patients to the emergency department, report to the staff their observations and the care they provided, and help provide emergency treatment. After each run, EMTs replace used supplies and check equipment. Some critical patients may require paramedics to transfer them directly to a helicopter for transport to a specialty care center. Some paramedics and some nurses with paramedic training work only on helicopter transport. Emergency medical technicians work both indoors and outdoors in all kinds of weather. EMTs work an average of 40 to 60 hours a week. Because most emergency services function 24 hours a day, most EMTs have irregular working hours that add to job stress. The work is physically strenuous. Much of their time is spent standing, kneeling, bending, and lifting. They may risk noise-induced hearing loss from ambulance sirens and back injuries from lifting patients.
Emergency medical technicians hold about 210,700 jobs in the United States.
Employment opportunities exist in private ambulance services, municipal fire, police or rescue squads, and in hospitals. In addition, there are many volunteer EMTs. More and more paid positions become available each year. Formal training is needed to become an emergency medical technician. EMT basic training is 100 to 120 hours of classroom work plus 10 hours of internship in a hospital emergency room or ambulance. The EMT basic program provides instruction and practice in dealing with bleeding, fractures, airway obstruction, cardiac arrest, emergency childbirth, and emergency vehicle driving. Students learn to use and care for common emergency equipment, such as automated external defibrillators, backboards, suction devices, splints, oxygen delivery systems, and stretchers. EMT intermediate training varies from state to state, but includes 35 to 55 hours of additional instruction in patient assessment, as well as the use of esophageal airways, intravenous fluids, and anti-shock garments. Training programs for EMT paramedics generally last between 750 and 2,000 hours. Applicants to an EMT training course generally must be at least 18 years old and have a high school diploma or the equivalent and a driver's license with a good driving record. Good handwriting is also an important asset for an EMT. Recommended high school subjects for prospective EMTs are driver education, health, and science. EMTs must be able to function professionally in all situations. Training in the armed forces as a medic is also good preparation. EMTs in fire and police departments must also be qualified as firefighters or police officers. EMTs should be emotionally stable, have good dexterity, agility, and physical coordination, and be able to lift and carry heavy loads. EMTs need good eyesight with accurate color vision. Driving the growth of employment for emergency medical technicians will be an expanding population. Also, the number of older people who are more likely to need emergency services is increasing rapidly. Additional job openings will occur as more states begin to allow EMT paramedics to perform primary care on the scene without transporting the patient to a medical facility. The future of EMTs may also include injury prevention and home safety inspection. Competition for jobs will be keen in fire, police, and rescue squad departments because of attractive pay and benefits and good job security. Opportunities for EMTs are expected to be excellent in hospital emergency rooms and private ambulance services, while the pay and benefits are more modest. A new area beginning to evolve will be critical care transport medic, those trained for new medical advances and medications.
Earnings for emergency medical technicians depend on the employment setting and geographic location, as well as the individual's training and experience. Median wages for EMTs and paramedics is around $29,300. The middle 50% earn between $23,150 and $38,000, with the highest 10% earning more than $49,000 per year. 27% of EMTs and paramedics belong to a union or are covered by a union contract.
It's never the same way twice. You never know what you're going to get into. Calls can range from everything from a cut finger to a bad auto accident to delivering a baby to cardiac arrest. It runs the whole gamut. The working conditions can range from going into somebody's home, which is nice, neat, and clean, to working in snow, to working in rain. We have to go out during disaster situations. I think the job outlook is very good. People get sick and people are in accidents every day. You have to be 18 years of age. You also need to have a clean driving record. Math skills are very important. English and writing skills are very important. Opening salaries for EMS for both EMTs and paramedics have been rising over the past few years. Well, I think my contribution to society is that people still have grandfathers and grandmothers and mothers and fathers who, if I wasn't there or somebody with my abilities was not there, these people would not be alive today. I think it's exciting. You never know what you're going to get into.
Emergency medical technician and paramedic are just two of the many occupations available to you in the career pathway of health-related occupations. Here are some others you may want to consider. Talk with your guidance counselor if you'd like to further investigate the careers of an emergency medical technician and paramedic, or any other career in the pathway of health-related occupations. Also, check out your local library. You'll find valuable career sources like the Occupational Outlook Handbook. It's a great reference to the countless careers available in the U.S. Good luck in reaching all of your career goals.